Hi, Emily.
Hi.
My name is Dr. Matt. I'm going to do your examination today.
Great.
So when was your last physical?
About a year ago.
Okay. Go ahead and verify your date of birth for me, please.
March 2nd, 1999.
Do you have any allergies?
I do pistachios, sunflowers, and salmon.
And no allergies to medications?
No.
Okay. Do you know your approximate height
5'7",
and approximate weight?
140.
Okay. Are you taking any medications on a daily basis?
Yes, just birth control.
Okay. For how long have you been taking those?
5 years.
Okay. Any medical history of hypertension?
No.
Okay. Any thyroid problems?
My grandma, yeah, she had thyroid problems.
Have you experienced any weight changes in the last 6 months?
No.
Okay. Any surgeries?
No, just my wisdom teeth.
Okay. Any accidents?
Yeah, just when I was younger, a car crash. But
Did you hit your head? Or did you have any broken bones?
I did break my arm. My right arm.
Okay. Any problems after healing?
No, it was a good recovery.
Okay. So what we're going to do, we're going to take vital signs first. And I'll have you change in this gown and we're going to start the exam.
Alrighty.
Are you experiencing any numbness or pins and needles in your hands or feet?
Sometimes in my feet, before I go to bed for some reason, I feel the pins and needles.
Okay. We'll take a look at your feet as well and check your spine alignment.
Right.
So for now, we're just going to take your blood pressure.
Okay.
Okay, go ahead and relax. Okay, blood pressure is a little bit low. 95/60. Do you feel dizzy at all?
No.
Okay, sometimes people just have a low blood pressure and they function properly. Could be a little bit of dehydration.
Maybe.
I'm going to put this on your index finger. Take your oxygenation. Okay, I'm going to put this on your forehead. 97.5. Oxygenation is 95% on room air. Heart rate is 81. Blood pressure was 95/65. Okay. Okay. I'm going to go ahead and have you lay down and I'll start by examining your face and your neck, okay?
Okay.
Okay, Emily, I'm going to start by palpating your auricular lymph nodes.
Okay.
We're feeling for any small lumps. Sometimes they could be the size of a pencil diameter.
Mm.
But everything feels good. And then post-auricular lymph nodes. I'm not feeling anything enlarged. Submental. Under the chin. And here we could also feel salivary glands. Not feeling anything abnormal. Okay, go ahead and swallow for me. Good. I'm not feeling the thyroid gland, which is expected. Trach is midline. Feeling a roll on the right side. And under the right mandible. It could be just a tensed muscle. Sinuses above the eyebrows feel normal size, nothing swollen there. Going to check your sinuses below your eyes. Alright, we're going to do a few tests here. I'm going to have you keep your eyes closed as much as you can. I'm going to try to open them, okay? Okay, good. And go ahead and lift your eyebrows up. I'm going to try to push them down. Don't let me do that. Okay, relaxed. And go ahead and clench your jaw. Good. Unclench. Alright, everything was symmetric. I'm going to check for any popping sounds when you open your mouth. So I'm going to have you slightly open your mouth. And now open it all the way. Very good. And close it slowly. Wonderful. There are no sounds there. Going to palpate your mastoid bone behind your ear. Anything tender or swollen here? Okay. Feels normal size. Looking at the hairline, there's normal hair distribution. Some alopecia here on the left and right upper side of the cranium. And we're going to look throughout the scalp area for more symptoms like that.
Okay.
I'm gonna have you smell this and please tell me what it smells like.
Eucalyptus.
Okay, so that was lavender.
Mm.
And I'm going to put one drop on your tongue. You can go ahead and open your eyes and tell me what this tastes like.
Strawberries.
Okay. All right. Take a few measurements. Go ahead and lift your head up for me and put it back down. Lift it one more time. Thank you. Go ahead and put it back down. Okay, can you please tell me if you feel this equally on left and right?
Yes, I can.
Tell me when you don't feel the vibration.
It stopped.
Okay. Do you feel it equally on both sides?
Mm-hmm.
Tell me when it stops.
It stopped.
Okay, slide it right there. Can you please tell me if you feel this equally on both sides?
Yes. 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 Yes.
Okay. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Dull. Sharp.
Okay. Perfect. Okay. I'm going to have you open your eyes and cover your left eye with your left hand. Can you please grasp the Snellen chart and extend your arm all the way? Go ahead and read the last row, starting with the first letter to the left.
All right. LTFPH.
Okay. And now switch eyes. Extend your arm all the way. Perfect. Read the last letter from the right to left.
HPFTL.
And what color is here?
Red.
And the other one?
Green.
Okay, good. Perfect. Take a look at your scalp. Okay. Can you tell me if this feels sharp or dull?
Sharp. Sharp. Sharp.
Okay. Do you feel this sharp all the way?
Yes.
Does it feel sharp or dull to you?
Dull. Dull. Dull.
And is this cold or warm?
Kind of warmer.
What about now?
Cool.
And now?
Cool.
Okay. Does this feel sharp or dull?
Sharp, sharp, sharp.
And did you feel that equally on all three sides?
Yes.
What about now?
Dull, dull.
And is this warm or cold?
Warm, cool.
Okay. Is this sharp or dull?
Sharp.
Okay, does this feel sharp or dull? Is this sharp or dull? Okay. What about now? Does this feel sharp all the way?
Oh, sharp,
And is it sharp or dull?
dull.
Is this warm or cold?
Warm, sharp, dull.
Scope sensory loss. It's very serious. It's an indication of a neurological impairment. So go ahead and tell me if you feel this sharp or dull.
Dull,
Okay. What about now?
sharp.
Very good. Alright, so this side looks good. Let's go ahead and check your left side. Okay, I'm gonna have you tell me if you feel this sharp all the way down.
Yes.
Okay. And does this feel cold all the way down?
Yes.
And is this sharp or dull?
Dull, dull, dull. Sharp, sharp. Dull, 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 dull.
Okay. We're gonna go ahead and check your back now.
Okay.
Okay, Emily. Are you comfortable?
Yes, super comfortable.
Okay. I'm going to start by palpating your neck area,
Okay.
posterior, feeling also for any occipital lymph nodes, but also noticing the curvatures of your spine. I'm noticing slight redness. thoracic area is normal. Not feeling any pulsations around the spine. No signs of scoliosis or lordosis, normal curvatures. Take some measurements. We're checking for any inflammation, asymmetry. Slight elevation of the scapula on the right side. But everybody's different. It's just a variation, not necessarily abnormal. Any numbness along the spine?
Nothing.
I'm going to percuss. Let me know if you feel any pain. Okay. And I'll tap on your spine. We're looking for any abnormal reflexes.
All right.
Pain there?
Mm-hmm.
Okay, I would like to look deeper into that area and see exactly why it's hurting you.
Yeah.
First, I will assess the level of inflammation.
Okay.
We're looking for any blanching edema. Okay, this is a pinching test. So just light pinching and then releasing.
Okay.
Can you feel the vibration?
Mm-hmm.
Go ahead and tell me when you don't feel it anymore.
I don't feel it anymore.
What about now?
It stopped. It stopped.
Okay, normal neurological conduction. Go ahead and tell me if you feel this on the left or right.
Right. Left. both.
Did you feel that equally on both sides?
Right, left, both, both, left, right, middle, 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 left, right.
Okay. Now, I'm going to touch you with two textures. One is going to feel sharp. This is what sharp is going to feel like.
Okay.
And the other one is going to feel dull. This is what dull is going to feel like.
Okay.
Okay, so go ahead and tell me if you feel sharp or dull.
Sharp, dull, 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 sharp, sharp, dull, dull, sharp, sharp, dull, dull, sharp, 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 dull, dull, sharp, dull, sharp, dull, dull, sharp, dull, dull, sharp, sharp, dull, dull, sharp, sharp, dull, 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 sharp, sharp.
I'm gonna go ahead and check your legs and your feet now.
Okay.
Have you noticed any swelling on your legs?
No swelling.
Do you have DVTs in your family?
No, I do
Your
not.
parents, grandparents? Okay, I'm going to slide my hand under your, go ahead and relax this one. And I'll just slightly lift this and I'll palpate your calf. Feeling for any edema, anything swollen. Good. Same thing on the other side. I would like to check your moles as well. Looking for anything that's raised. Okay. Take a few measurements here. I'm going to check the circumference of each leg. looking for any asymmetry, which would be a sign, an indication of slight swelling or fluid retention. Okay, they are equal in size, which is normal. Going to palpate your legs and your feet. Normal temperature bilaterally. And locating now pedal pulses. Okay, good peripheral circulation. We're going to check a capillary refill within 3 seconds. Perfect. Okay. Now I'm going to have you relax your foot. Very good. And I'll slide the hammer across the sole of your foot to elicit a neurological response. We're checking your Babinski reflex now.
Okay.
Perfect. Perfect. Okay. Go ahead and tell me if you feel this sharp or dull.
Okay. Sharp. Sharp.
And did you feel that equally on both sides?
Yes. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Okay. Now I'm going to touch you with 2 pointy objects. So it's going to be 2 in the same time or only 1. This is what 2 is going to feel like. Okay. And this is what 1 is going to feel like. Okay, so go ahead and tell me if you feel 2 or 1.
1. 2. 2. 1. 2. 2.
Okay. Does this feel cold or warm?
Cool.
Cold or warm?
Warm.
What about now?
Warm.
And now?
Warm.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
Stopped. 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 Stopped.
Okay. Wonderful. Alright, so we finalized the examination. I'm going to have you sit up and we'll talk to the results. Alright, I'm just going to remove my gloves here. So this was a normal head-to-toe physical exam, and next time we're gonna have to do a vision check. We skipped that, definitely because you were laying down, but we can definitely have you referred to an ophthalmologist to check your vision.
Okay.
All right.
Sure.
I did not see any deficiencies. I don't think you need any further testing, so that's a good sign.
Yeah, great.
Do you have any questions for me?
No questions, doctor. Thank
Alright.
you.
Thank you as well for coming in and for allowing me to do this exam on you.
Of course, thank you.
Hi, Ivy.
Hi, Matt.
How are you?
I'm good. Thank you.
Wonderful. Today I'm going to do your foot massage and pedicure. So go ahead and relax.
Okay.
I'm going to go ahead and take your slippers off.
Okay. Thank you.
I'm going to ask you to lift your feet up. Perfect. Place them in the warm water. Is that good temperature for you? Perfect. Just one more time, lift them up. All right, perfect. So I'm going to start with a Himalayan detoxing salt. It has lavender and tea tree oil. I'm just going to lift your robe a little bit. So I'm using a tea tree and lavender scrub as well to remove any dead skin cells. This allows for skin regeneration. Okay, just going to place them back in the water. place your foot back in the water, and we're going to rinse. Okay, we're adding some ginger and green tea to our water. It helps to reduce inflammation. Okay, we have a foot mask, ginger green tea as well. We're going to apply it on the sole of your feet. Okay, go ahead and lift your left leg up. Perfect. So this is a foot mask. We're going to apply it evenly. Okay, go ahead and lift your other foot up as well. I also have a hydrating mask. It helps to heal dry, cracked skin. Okay, go ahead and let your head go. Perfect. Okay, we're going to do the same thing on the other side, and then we're going to leave it for about 5 minutes. Okay, relax. Okay, while you wait, would you like some hot tea?
Sure, thank you.
Go ahead and remove the wrapper. Okay, relax. Okay, I'm gonna go ahead and start by gently rubbing your feet with this clay scrubbing stone. apply a little bit of anti-inflammatory oil. And we're going to work on increasing blood circulation today. Okay, we're going to perform some cupping therapy. We're going to help your lymphatic system to drain the toxins. We're going to work on your lymphatic drainage as well to help your body release the toxins. Okay, let me know if this hurts. I'm just going to apply some gentle pressure. Okay. That's a more of a sensitive area right there. Is it ticklish or it hurts?
Doesn't hurt, I just feel it a little bit more.
Okay. some pressure therapy. Okay, we're activating the main organs to help release toxins. And these are the points that help with relaxation, stress relief, and insomnia. Applying some cold therapy helps to relieve inflammation, reduce swelling in the extremities. Just applying gentle pressure. Okay, this allows for increased pressure on the sole to help to relieve inflammation. Okay, I'm just going to put your flip-flops back. Go ahead and bend your knee. And thank you for coming in. Namaste. Hi, my name is Dr. Mad.
It's nice to meet you.
Nice to meet you too. How are you doing?
I'm okay. Not
Okay.
too bad.
So you're here for your annual physical?
Right, correct.
Okay. Can you please verify your date of birth and your last name?
My date of birth is October 28th, 1999, and my last name is Frank.
When was your last physical?
It was about a year ago.
Any concerns that you would like to address again?
Yeah, high cholesterol runs in my family, and I'm just a little concerned about pre-hypertension.
Do you have any allergies to medications?
Penicillin.
Okay. Do you have any thyroid problems?
No, I don't.
Okay. Any abdominal discomfort?
Not at the moment.
Are you experiencing any pain anywhere in your body?
I have headaches sometimes, so that's a slight concern, but besides that, no.
Okay. How often are they?
Say twice a week, sometimes
That's
3 times.
pretty often.
Yeah.
All right. Have you noticed that they're more frequent at night or in the morning?
Usually in the morning or afternoon.
Okay. Do you think they might be triggered by something you eat?
I'm not
Diet
sure.
related?
Sometimes on the days I have coffee, it could be related to that.
Yeah, definitely dehydration can cause migraines. But we're going to do a neurological assessment as well just to make sure that nothing else is related to it.
Okay.
Are you taking any medications?
Not at the moment, no.
Okay. Okay, and you're not taking multivitamins at all?
No.
Any surgeries?
I did have appendicitis, but that was 5 years ago.
Okay. Any breathing problems?
No.
Okay. When was your last pap smear?
It was a year ago.
Okay. So you are not due for one yet. We will have you scheduled for this next year.
Okay.
Okay. Any head injuries?
No. No.
Any problems with your back? Are you experiencing back pain?
No back pain.
Okay. Okay. I'm going to go ahead and take your vital signs. I'm going to take your temperature. Have you noticed any flu-like symptoms?
Not recently, no.
Okay. All right, I'm going to place this under your tongue, and I'm going to ask you to hold it for a few seconds. Go ahead and hold it for me. Perfect. And then we'll place this on your right arm. 97.1. That is good. Did you have anything to drink before you came in?
I had some water.
Okay. Was it
Yeah.
room temperature?
Yeah.
Okay. Actually, blood pressure is really low.
Oh, really?
80/60.
Oh, no.
Are you experiencing any dizziness?
Not usually, but sometimes with the headaches. When I have the headaches a little bit.
Do you have headaches right now?
No, earlier in the day,
Okay.
but I'm fine now.
All right, so blood pressure 80/60. Let's go ahead and take your pulse. I'm going to put 2 fingers on your wrist. Okay, and we're going to go ahead and compare. 2 plus. All right. Capillary refill is within 2 seconds. That's really good. All right, so taking a look overall at your appearance, I'm not noticing any distress, normal color, no cyanosis around your mouth, face is symmetric as well, and you carry your body in a symmetric way. And I'm going to go ahead and just palpate your head, see if there is any asymmetry or any lumps.
Okay. Yeah.
Okay. Okay, I'm going to go ahead and palpate your neck. We're looking for any lymph node enlargement. Can you please shrug your shoulders? Okay, good. All right, you can go ahead and relax. Okay. Palpating sinuses under your eyes. Nose is a little bit asymmetric. I'm going to take some measurements. Okay, so that circumference is 60.5. we're going to measure your arm. So we're looking for any asymmetry between left and right as well, to see if there is any type of swelling. Also to see if there is a proportionate length of your arms compared with the torso. All right, go ahead and put your arms a little bit like this. I'm going to measure your waist. Okay, you can go ahead and put them back down. Everything looks good. I'm going to listen to your heart and your lungs. Okay, this is going to feel a little bit cold. Is it okay if I slide the stethoscope under the shirt?
Yes.
Okay. And is it okay if I put the stethoscope under the shirt on the lower side?
Yes.
Okay, I can hear only S1 and S2. No S3, no S4. Let's go ahead and check with the bell. We're looking for any murmurs. Since we're definitely concerned about having hypertension in the family, we want to be able to catch this ahead of time. Very good. So no murmurs. I'm going to listen to your lungs. Go ahead and take a deep breath in for me. And exhale. Good. And again, take a deep breath in. And exhale. All right, I can hear only bronchial sounds. I'm just going to listen to the side. Take a deep breath in. And exhale. And again, breathe in. And exhale. Okay. Are you wearing contacts?
Yes, I am.
Okay. I'm going to flash a light in your eyes. Go ahead and look straight at my nose. Okay, very good. Can you please follow the light with your eyes only? Don't move your head. Okay. Okay. And I'm going to check your ocular nerve as well. For this, I'm going to ask you to look behind me straight at the wall. I'm going to come very close to your eye and examine. Just try to keep your eye open and keep focusing on the back wall. Very good. Very good.
Great. Awesome.
Okay, I'm going to check the back of your throat now.
Okay.
So we're looking for any swollen lymph nodes. Okay, go ahead and open your mouth and give me a big ah. Alright, there is no redness, everything looks very good. Your left midline. Can you please move your tongue up and down for me? Up and down. Any difficulty?
No.
Side to side. Okay. Can you push with your tongue inside your cheek? And the other side? Okay. Can you give me a big smile? And frown? Frown with your eyebrows. All right. Let's go ahead and try to frown again. Okay. Now go ahead and raise your eyebrows up. I'm going to try to push them. Don't let me do that. Go ahead and keep them up. Very good. Okay. I'm going to try to move your head to your right. Don't let me do that. Good. And same thing with the other side. Good. Can you please shrug your shoulders? Okay. Can you squeeze my fingers? Okay. Put your arms in front of you just like that. I'm going to try to push them down. Don't let me do that. Okay, I'm going to try to open them. Don't let me do that. Good. So I'm going to try to close them. And I'm going to try to push them up. Good. Go ahead and relax. Okay. I did notice a deviated septum. Do you snore at night?
Not usually.
Okay, that's a good sign. Sometimes people are just born like that, or if you had an accident that you maybe don't remember, it was in your childhood, something like that could trigger. But let's go ahead and take a look and see if there is any obstruction, okay?
Okay.
I'm going to have you look up. Go ahead and look up for me. Okay, looks good. Okay, very good. Okay, we're going to check your hearing. Can you please tell me when you don't hear the sound anymore?
I don't hear it. I don't hear it.
Can you please tell me which position here is louder? 1 or 2?
2.
1 or 2?
2.
Okay. Okay, I'm going to check inside your ears. This is part of the annual exam. Okay. The bonding membrane is broke, right? No signs of infection there. Very good. Just a little bit of earwax, but nothing to be worried of. I'm going to go ahead and palpate your arms. We're looking for anything swollen. Okay. I'm going to go ahead and check your back now. I'll have you face the wall.
Okay.
All right. All right. I'm going to go ahead and take a look at the spine. So we're looking for any signs of deviated curvatures. I'm not feeling any kyphosis around the neck area, which is great. Okay, go ahead and try to touch your chest with your chin. Okay, perfect. So this just accentuates the curves. Okay, you can come back to center. I'm going to touch you with two textures. Can you please tell me if this feels sharp?
Yeah, it was a little sharp.
Okay, and this is going to feel dull or fluffy. So go ahead and tell me if this feels sharp or dull.
That was sharp.
What about now?
That was dull.
Okay, so go ahead and just say sharp or dull from now on.
Okay. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull.
Okay, going to take some measurements. Okay. We're looking for any abnormal responses. Okay. Any pain as I was tapping you over here?
No, I'm just too ticklish.
Okay. Go ahead and take a deep breath in. Breathe out. And again, take a deep breath in. And breathe out. One more time. Breathe in. Exhale. And again. Okay, I'm gonna have you lay down and I'll examine your abdomen. Okay, Nicole, I'm gonna go ahead and check your abdomen as well. Is it okay if I open the jeans a little bit so I can take a look at the lower side? All right. Okay, so we're looking for any asymmetry. No pulsations. I'm going to listen for any aortic regurgitation. percussion sounds, checking liver for any inflammation or organ enlargement. Okay. Checking right ovary and left. Good. Okay, everything looks normal. I'm gonna go ahead and take a look at your legs and feet as well. I'm going to go ahead and remove your socks and I'll place them here on the floor. Alright, we're going to check pedal pulses first. Good, 2+. We're looking for any edema. I'm not seeing any swelling. Looking between the toes for any discolorations. Capillary refill is within 2 seconds, and bilateral warm temperature. Okay, we're going to check Babinski reflex. Okay. Okay. Very good. All right. I think that looks good. Let's go ahead and check your reflexes. So for this, I'm going to ask you to go ahead and bend your knee and put it on top. There you go. Perfect. So just keep it like that. Okay, good. And we'll do the same thing on the other side. Just a little bit lower. Okay. That was normal. I'm going to have you sit back and we're going to check your other reflexes. Okay. We're going to check your other reflexes. Go ahead and relax your jaw. So kind of like lower it a little bit. Perfect. Even a little bit more. Too much? Okay, great. Good. And we're looking for hypo or hyperactivity. Good. Okay. Relax. Very good. Very good. Okay, perfect. We're going to order some blood work for you. It's part of the annual exam, and we're going to check your troponins just to make sure that you're not having any heart problems.
That's good.
Your back and your abdomen sound very good. Everything looks healthy, and I'm not concerned at all. Do you have any questions
great.
for me?
No questions at this time. Thank you so much.
You're welcome. Okay. I will call you back with the blood results, and we'll go from there.
Awesome. I look forward to your call. Thank you.
You're welcome. Next person in line. Hi. Okay, go ahead and stop. Passport.
Right there.
All right. Can you please state your full name?
Sure, it's Katie ASMR.
Okay, date of birth.
March 23rd, 89.
And where are you traveling, ma'am?
I'm going to New York City.
Okay. Is it business or leisure?
It's business. I'm going to a convention for makeup artists.
Okay. And are you traveling with any firearms, any
No.
explosives?
No.
Okay. Are you wearing anything sharp on you?
Nope. Just my hip bones.
Okay. Just looking to see if this is valid passport.
Sure.
Sometimes people come in with fakes.
Okay.
All right. And how many days are you going to stay in New York?
A week.
A week. And what do you do for work?
I'm a makeup artist.
Okay. Are you traveling alone or with family?
Alone today.
Okay.
Everyone's here with me.
All right, ma'am. Let's go ahead and we're just going to do one check. Go ahead and put your palms up. I'm going to run this through our database.
Okay.
It looks like you were pre-selected for a more detailed TSA Pat Down. We're going to have to do a very thorough body search, okay?
So
go-
we have to. I'm running a little late.
Yeah,
So if we could
we
skip
have
it.
to. It's the law.
Okay.
So go ahead and remove anything that you have in your pockets.
I don't have pockets. Oh, yeah.
Okay. You have a dog? All right, and go ahead and put the backpack down slowly. Okay, we're just going to do a preliminary check. Okay, ma'am. Looks like there's nothing in here. Okay, lots of makeup brushes. We're going to go ahead and check this.
Okay. Are you gonna do that with every makeup brush?
No, we're just going to check on only one. And if this comes back positive, we're going to go ahead and check all of them, yes.
Positive for what?
Any illegal substances.
Oh.
Yeah. So you don't have to worry as long as you didn't. Okay. Okay, we're gonna go ahead and check this as well. So we're looking for anything that could cause an infection. I'm sorry if I'm putting some infection on your eye. Think you can disinfect it at the end.
Thank you.
All right. And now we just have to wait a little bit for those results to come back. And since we have so much time to spare, I'm going to go ahead and continue with the search. This is a pretty bad here. Okay, do you have lots of makeup there?
I do.
Do you have mascara as well? Is this mascara?
It sure is.
Okay. I'm going to go ahead and let's what else do we have here? Okay, you should clean this from time to time.
Yeah, I know.
I'm gonna go ahead and do a check on this as well. Let's see what else we have here. Looks like you have lots of massage tools.
I do.
Are you a massage therapist as well?
No, my legs get cramped after sitting for a while. So after sitting on a plane and at the convention, it's just to use them on my thighs. Just to
Okay.
circulate the blood flow. It's supposed to be healthy.
Okay, ma'am, what else do you have here? I see something very pink and shiny. Oh, interesting. So you do cupping on the airplane?
Not on the airplane, but after I get off the airplane.
Oh,
yeah.
okay.
And my own personal time.
Okay. Don't worry, I got this. Alright, that's a toothbrush. We do not want to check that.
I haven't either.
So, any explosives in here?
No, I don't know why I would be carrying explosives, but you're welcome to check.
Alright, we're gonna go ahead and place this aside. Go ahead and remove your coat, please. You have lots of zippers in here and pockets.
Yeah, it's so
I
cool.
hope you're not hiding anything.
No, I'm not.
Alright, so you came through my database that you are also a TSA officer.
Yes.
Why didn't you tell me that?
It's something I kind of dabble in. Kind of moonlight as a TSA officer. So.
Well, you know, I wouldn't do such a thorough search to one of my fellow coworkers, but I have to.
Okay, all right. I know. I tend to be thorough as well. It's just you seem to be kind of excessive.
We'll do what you gotta do. And you're not excessive?
No, not at all. No,
Oh.
I'm very reasonable in the way I approach passengers.
Okay.
I have a little bit more finesse than you.
I see. Yeah, I'm very, very rough.
Yeah.
I like that.
Yeah.
All right. we're gonna go ahead and send everything that we got so far to the lab.
Okay.
And are you ready for a body search?
As ready as I'll ever be. Yeah.
We want to make sure that you're not wearing a wig.
Even if I was, why would that matter?
Somebody can hide things under a wig so that we won't be able to find them. But that's okay. We're just gonna go ahead and take some samples from your hair as well. So you don't need to worry. I'm just gonna have you look this way. Okay. Okay, I'm gonna have you turn around. Okay. So I do have to check to make sure that this is not a wig. We're gonna go ahead and pull the hair a little bit up from the scalp to make sure that this looks very natural.
Oh dear.
We are trained to find some of the best wigs.
Yeah.
This is one of the tests that we need to do. So go ahead and look
I
that way.
never received that training, so I don't know where you were trained, but
Okay. Ow. Okay.
that hurt.
All right, I'm gonna have you turn around and we're gonna start inspecting your chest.
Okay.
Sometimes people can have skin implants with explosives and electronics that they should not be wearing on them. So we want to make sure that there's nothing under your skin.
I think a lot of trouble someone will go to.
Yeah, and I don't get paid enough, so it is what it is. Okay, let's go ahead and check the chest area as well. Yeah, that is definitely your collarbone.
What else would it be?
I don't know. Okay, good. Did you break a collarbone here? It seems like it's a little bit swollen. I know a very good doctor who can take care of you if you want.
Yeah. I mean, I don't know when that happened, but my collarbone's always been little.
Yeah, it's a little bit
Funky.
swollen here compared with this side, but okay. Oh, I forgot to check this side. Okay. So I'm gonna check your upper body. Go ahead and put your arms like this. Ma'am? Sorry. Ma'am, are you wearing a wire?
A wire.
Yeah, what is this?
Oh, that's it's like a app. It's like a heart monitor. So it monitors my heart. It's a medical device.
You're mumbling too much. Is it or is it not?
It's a medical device.
Okay.
And it has wires, but it's not what you think.
Okay, because I asked you if you're wearing anything on you and you said no.
I forgot all about it. I wear it all the time.
Put your arms like this. Okay, it's your last chance. Are you wearing anything else that you did not tell me about?
A bra and underwear.
Okay. Any medical conditions other than your heart problem that I should be
It's
worried
not
about?
a problem. It's just
A disorder.
it's not a disorder. It's
Okay.
like a new thing. You haven't seen the ads for it? It's like you can hook it up
I
to
don't
your...
watch the news.
It just helps to monitor your heart rate throughout the day.
Okay.
I'm just...
I believe you. I believe you. All right, I'm going to have you turn around. Let's go ahead and check this monitor of yours. Is it this one? Go ahead and put your arms like this. Okay, ma'am, we're gonna go ahead and check your lower body now. Okay. I'm going to move your heart monitor in the front, if that's okay, or here on the side.
Okay.
All right, I'm gonna have you open the legs. Good. I'm going to put my hands up the groin. I'm going to put my hands up the groin. Okay, go ahead and turn around. Come a little bit closer. Good. I'm going to put my hands up the groin.
Okay.
I'm going to put my hands up the groin. Okay, so let's go ahead and remove your shoes. Okay.
Don't think you're gonna find anything in there.
I believe you. I believe you, but we still have to check, okay? So just be patient. These are very nice boots.
Thank you.
We're going to be very careful. gonna have you remove your socks. Okay. Okay, we're gonna run these socks under the x-ray. All right, go ahead and step forward. All right, I'm gonna have you turn around. And I'll have you lift one foot up at a time. Go ahead, okay, and relax.
I'm sorry.
Okay, that was all. Very good. Okay. Are you hiding anything in between your toes?
No.
Let's see. Okay. And now we're just gonna go ahead and check for any residue. Okay, next foot.
Sorry, let's take away.
Okay, are you hiding anything in between your toes?
No.
Okay. Ma'am, the results came inconclusive, so we have to take your DNA, test it, and see if we can find you in our database, okay? Now, have you ever had a swab before?
No.
All right, I'm gonna have you open your mouth. We're gonna swap the inside of your cheek a little bit more. Good. Okay. So I'm gonna send this. And then, have you ever had a tongue scraping before?
Guess now is as good a time as any.
You don't
to
do
try.
those in your airports?
No, I'm very relaxed about my job.
All right,
And
tongue out, ma'am. That's it. Thank you. I'll be back.
I don't do half of the stuff that you've been doing, and I've never had a security breach, so I feel like it's all very unnecessary.
No worries. It's fine. Is this your backpack? Are these your shoes?
Yes, they are.
All right, ma'am, here. You can go ahead and have these. Let me.
Okay.
You had a jacket. Let me find that for you.
Yeah, that'd be nice. Thank you.
You're welcome.
All right.
Okay. Now, everybody's safe. So, thank you for your cooperation. Have a
Okay.
safe flight.
Okay, if I made it,
Yeah.
I'll see.
Yeah. Next in line. Hi, Nicole. I'm Dr. Mad. I'm gonna go ahead and take a look at your abdomen. Okay. I understand that you're having some discomfort.
Yeah.
All right. So, is it okay with you if I open the gown?
Yes.
Okay. Okay. We're visually taking a look to see if there is any redness, asymmetry that's very obvious, and everything looks symmetric. I'm going to go ahead and listen. All right, I'll have you relax. This is going to feel a little bit cold. abdominal sounds are a little bit hypoactive. Sometimes drinking more fluids and increasing fiber can help that. How would you describe the pain? Is it sharp or dull?
It's more moderate in the middle.
Okay. And is it constant or it comes and goes?
In the mornings, I feel it more.
Okay.
Yeah.
And on a scale of 0 to 10, how would you rate them?
5 to 6.
I'm going to go ahead and percuss. Let me know if you feel any kind of pain.
Okay. A little bit there.
Okay.
There too. Right there.
So far, normal percussion sounds. I'm going to go ahead and palpate.
Okay.
Okay, I'm going to feel your kidneys. I'm going to slide one hand behind your back. Very good. And we're going to palpate and just gently press down. Good. And same thing on the other side. Okay. I'm going to take a few measurements. So we're looking for inflammation. And there's about a 10% increase in angles on the left side. Okay, this is going to feel a little bit cold. We're just taking more measurements to see exactly the level of inflammation that you have in the abdominal area. going to check neurological responses. So go ahead and tell me when you don't feel the vibration anymore.
Okay, I don't feel it.
What about now?
Now I don't feel it. And now I don't. Now I don't feel it. Yeah, it's good. Don't feel it. Stopped. Don't feel it.
Very good. We're going to check skin turgor, which usually determines the level of hydration and nutrition. So this is just a pinching test that we use to see exactly the elasticity of the skin. And now we're looking for any abnormal skin growths. Good. Okay, I'm just going to go ahead and tap on the bony prominences of your cage rib. We're looking for any abnormal responses. Something that would indicate inflammation of the liver and main organs. Okay, very normal responses. And these. Okay. Okay. Go ahead and tell me if you feel this cold or warm.
It was cold. Very cold. Yeah, cold. Warm. That was cold. Warm. Cold. Warm. Warm. Cold. That was warm.
Go ahead and tell me if you feel this on the left or right.
My right side. My left side. Left. Left. Right. 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 Left. 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 In the middle. middle left.
Okay. I'm going to apply some acupressure. What we're going to do today is to do an anti-inflammatory treatment. It's going to help to lower some of the inflammation that you're having in the abdominal area. We're going along the line of the medial muscles. I'm going to apply some anti-inflammatory oil. I like to use olive oil as the base. It also helps to hydrate the skin. And it stimulates blood flow. Let me know if you're pressing too much.
Okay.
Okay, so we're just gonna go ahead and slowly massage the interior part of the abdominal muscles. This technique usually also helps to tackle some of the belly fat. And also to restore homeostasis. I'm going to apply a little bit more oil. And we are going to perform cupping therapy. It also helps to destroy some of the cells that can trigger inflammation. This is going to feel a little bit cold. Okay, Nicole, I'm going to go ahead and close your robe. And whenever you're ready, I'm going to have you sit back on the table. Okay. But I would say that the treatment was definitely a success.